Welcome to The Way Home with Laura Smith, the show that brings you wonderful guests, helpful advice, and uplifting stories. The Way Home. Live inspired. Here's your host, Laura Smith.
Well, I had an experience yesterday that I will not be forgetting anytime soon because I actually feel so good and so much better than I did before going in that I had to share it with everyone. I was fortunate enough to meet someone in my northern Indiana area of, Napanee, Indiana, which is near where I live in Elkhart, Indiana. And I met a very interesting person who has obviously a gift that I think so highly of. I want to have her tell you about it and teach you about it. Her name is Dr. Sloan Samulski. She is all different things, so it's going to take me a moment to rattle these off, but she is a doctor of naturopathic holistic nutrition, a diplomat of medical acupuncture, a licensed massage therapist, a board-certified holistic nutritional practitioner, and a board-certified natural health practitioner and certified in myofascial release therapies. Wow, that is a long resume. Dr. Sloan, thank you so much for being on The Way Home.
Thank you so much for having me.
First of all, I was interested when I heard the kind of work that you do, because coming from New York, those are a lot of things that I took part in for many years, for 4 decades that I lived there. And I would often get massage or acupuncture. I would get regularly. And it's something that my health insurance there actually paid for. So I found out very quickly that there are so many benefits to holistic healing that often just Western medical practices don't always either embrace or execute and use. So I was kind of, over the last 5 years that I was here, I was looking for something similar that I could experience and go to like I did in New York. And lo and behold, there you are, somebody who has a few different offices, some in Michigan and the one in Napanee, Indiana. And I have to tell you, I am just so grateful to have found you, because to find people that have real expertise in a lot of those areas that you do. I mean, some people get massage therapy certificates and things like that, but to be really well-versed in nutrition, which is one of your, you have your doctorate in nutrition, but also these things that I had read about but had never experienced. Myofascial, am I saying that correct?
Yes, myofascial release, yes. Release,
and then craniosacral, is that the other one?
Craniosacral therapy, yeah.
So I had always wanted to know what it was about. And yesterday I really got right up close and personal to have the experience. And honestly, I can say it's not in my imagination. I feel better today. And so I want my listeners to maybe hear what could maybe be waiting them if they were to go this route of this wonderful holistic route of healing and health.
Well, thank you for your interest, first of all. Going holistic is such a big movement, and has been, I think, in the last decade with so many people. I think they're getting tired of having to be medicated, or possibly having to be medicated for a symptom rather than trying to find the underlying cause of whatever's going on in their body. And they want to be able to heal themselves. And our bodies are designed to heal themselves. And this is just a couple of different modalities that help to facilitate that healing process. And I do massage throughout the session, because massage covers, all 11 major organ systems at the same time. So I think to incorporate that helps to relax the patient as well. And then we can get down to whatever we're trying to deal with, whether it's trigger finger, or whether there's so many different lymphatic drainage, whatever the patient is coming in for, we're able to target that in one particular session.
It's so interesting because, what is lymphatic drainage, and why do I need it, and what does it do?
Yeah, so lymphatic drainage is, we have our lymph nodes. They're located on various parts of the body, and lymphatic drainage typically is where the lymph will pool, because it's backed up. It could be medically backed up by some type of prescription drug that someone was taking, perhaps for migraine, for post-cancer patients. It could be anything that's backing that up. And it becomes very painful because it's the inflammation of that tissue in that area, and it can certainly restrict any type of movement. So to get that lymph moving again, there are multiple modalities to try to get that moving and to ease that pressure and to get the soft tissue healing and to get that nice flow again in the body. Yeah.
I mean, it was very much like a massage therapy session, but there was something so different about it at the same time. I was trying to explain it to my friends last night because he, for example, is someone, he's been suffering from sinus issues and headaches and things for forever. And they just cannot seem to find what's causing it. And so I was trying to explain it to him, and he's like, count me in. It sounds like, I'll try anything at this point.
Yeah.
And I said, and then this morning when I woke up, and I've been having this arthritis for the very first time in my life, in one finger. So I guess I'm fortunate that it, is only starting now, but you did something. You worked on my hands and my arms and the rest of me. And I woke up this morning, and for the first time in the last 6 months, I have zero pain in that finger. And it just it honestly feels like a miracle. At first I thought, am I psychosomatically telling myself that I feel better? And then I keep pulling on it. I keep pressing it. And I'm like, the pain is gone, and I cannot explain that. So what was it within this modality that you did with me yesterday that felt very much like an incredible massage, but you also had ways of pinpointing certain spots and the way you would press or the way you would pull or whatever, it felt like it just moved the energy in my body or something. Why is it that having this type of deep tissue, of the two modalities that you said, the myofascial and the craniosacral, why would that take away pain in my finger?
Well, I don't think that it was particularly craniosacral that was used there. That was more of almost an acupressure point that we were using to help to increase the blood flow in that area. But I wish I could explain all of it as well, but my body follows your body. So your body, the bodies talk to each other, right? So your body will say, oh, there's something over here that I'll be feeling when I'm palpating. So all of a sudden, if I go down to your hand, I find, oh, okay, so there's a restriction there. And so then I will apply one of the modalities. So in that particular instance, it was a little bit of myofascial and also some acupressure mixed. And then there's always that energy, that zhuzh, we were talking about yesterday.
Yes. That's your own word.
Yeah.
May not be very,
medical. It's
medical sense. No, zhuzh. But whatever it is, you got the zhuzh out of my finger, and I couldn't be happier. Yeah.
Yeah. So just getting the zhuzh out, but sometimes, sometimes it's just moving that fluid and getting that circulatory system. And maybe there is some extra buildup of muscle tension there. So, and it's just getting that moving and everything to open back up again. And you get that release. I work on a lot of trigger finger, and sometimes it's just opening up that channel and allowing that freedom to come back through there. And it could be working on a scar tissue area. Same thing. You get that restriction from scar tissue, which is just, the cells are all they get bonded up, and then you can just slowly work out that tissue. So it's more viscous so that you get that fluid going and you have that freedom in your movement.
Absolutely. What are some of the common things that people come to you with? You mentioned trigger finger. And I think TMJ you worked on with me yesterday because I just recently got a mouth guard for the very first time in my life. Now, I think I feel like I'm falling apart or something, but you get to a point in your life when, you notice little things. And so I just got a mouth guard because I clench my teeth at night and I was cracking my teeth and fillings were falling out and things like this. So he gave me a mouth guard. But you did something to me on the table yesterday, and it seemed to relax that area. And I wouldn't have imagined in a million years that what you would do on a massage table would be able to fix that. I thought it was just tension in my nervous system that caused me to clamp down while I was sleeping. But I don't know.
Well, I mean, typically I do treat quite a few people with TMJ, but that's just a small portion of the larger portion. So when you're working holistically, you're working with the entire body, you're working with the entire system. And sometimes, so TMJ is temporal mandibular joint. So it's that connection between the skull, the temporal plate and the mandibular joint in your jawline. And so I'll go in orally, so with, inside your mouth, and just release it with the myofascial, which is a very soft movement, but it helps to slowly unwind the fascia, which is that connective tissue. So we have fascia running throughout our bodies. It's that white substance that it looks like a liquid tissue, and it works like a spider web. So you touch one end of it and the other end you can feel moving across the body. But this just kind of slowly moves down through that particular tissue, and it softens it, and it just slowly unwinds and releases. And sometimes people explain it like you feel the champagne bubbles or whatever, just the tingly set. Some people don't feel it at all. It doesn't mean it's not working. So it slowly will unwind that specific joint, and then you have the release. And lots of times during the night while you're sleeping, you could have some type of trauma or some type of anxiety when you're sleeping or trying to solve all the day's issues, and that's when you'll clench and stuff. But this just helps you to have a lot looser. You're not going to be dealing with clenching throughout the night because you've loosened it up. And if you do, then we'll treat it down the line when you need it again. I always say to everyone, my job is to get rid of my job. So you're supposed to, it's not like, come in for 7 appointments or whatever. It's whenever your body is back into homeostasis, then enjoy life. Go live life. Go live it hard. And then when you need me, come on back.
I woke up this morning after having that divine session with you yesterday. And I honestly, because I get up very early to do the morning show during the week, and I am often very, very slow moving, groggy, exhausted. And today is the first time my partner said on the air, he's like, wow, you look better today than you have all week, because I've just been, I'm dragging sometimes.
Sure.
Because I, start working at 6 o'clock. I start, doing the morning news show. And I just had this beautiful sense of energy and vitality this morning, and that hazy fog around my brain. It felt like it wasn't there. And I thought, well, maybe I slept better, but I actually was able to fall asleep better last night than I have all week.
Yeah.
So does that help? Does it have anything to do with that as well?
Absolutely. So the craniosacral work works primarily on the vagus nerve. So that goes from your head all the way down to the belly. It's going down the spinal column, and that is the central nervous system. So it's working the parasympathetic nervous system within your body, and that helps you to calm and to rest. So it gives you that peace in your body, regulating the rest and the calm and the relax. It's not the fight or flight, but it's not the sympathetic nervous system. It's doing the parasympathetic nervous system, which is calm and relax. And so you would have had a better, deeper sleep. Sometimes that's why I like to have that seating room out front, because I always encourage people to get back in their head before they get in their car, so they just, calm down a little bit afterwards and have a seat and sip some water before they go on to head on their way home. But yeah, it would have given you more deep rest. And today, yeah, you should have more energy because your body is kicking back into where it's supposed to be. So, yeah.
Well, I am super grateful to you. My guest is Dr. Sloan Samulski. She owns Weston Holistic, which has, I believe it's 3 locations now in Michigan and Indiana.
Yes. So I am in Richland, Michigan. I'm in Schoolcraft, Michigan, and I'm also in Napanee, Indiana.
Yeah, so you have, if you're in the Michiana area listening right now, you have it there. But I'll tell you, if it's a matter of driving up from, say, Fort Wayne, if you're hearing this, to get a session with her, I would highly recommend it because, I don't think that everybody, so there's a lot of people with knowledge and background and all these things. And there's also the type like you that I think you instinctively have these abilities that I would say would put him in the category of gifts as well, because it's hard to say that what I experienced yesterday wasn't something that not everybody would be able to do, just getting the certificate. I think it takes something, an intuition, an inner guidance system of your own GPS that takes you to the right places. And you were able to tell me where I was having issues before I was able to tell you. And yet, sure enough, you were absolutely right on.
Yeah, I appreciate that. And I do value every single one of my clients. I know that you're there to feel better and to get better and to have the best experience. It's not my session, it's your session. And the session is totally patient or client based. And like I said earlier, my job is to get rid of my job. And I just enjoy helping people live their best life and live their healthiest life. So however I can facilitate that, that's what we'll do in that session, whether it's through craniosacral therapy, through myofascial release, through acupuncture, lymphatic drainage, whatever somatic counseling, whatever you're looking to work on.
But let me tell you, this doesn't hurt at all. It is so relaxing. It felt like I was just getting an amazing massage, even though I knew there was much more going on. Mm-hmm. Not that just having massage isn't helpful. It is, obviously, but this had different intentions to it. But I was so relaxed. It was like a spa-like quality in your office. And I just really, I can't recommend it enough. So good. Now, where does your nutrition fit into your practice now? Do you use it with your clients that come to see you for this type of work that's done on them, any type of nutrition, or not necessarily?
It's kind of morphed into, over the years, I would have nutritional clients come in for nutritional counseling per se, but now, just like everything else has kind of morphed into one particular session, when a client is on the table, there are lots of questions that come up. And again, it's their session. So however the questions come up, I'm more than happy to answer any of them. And sometimes we're talking nutrition while I'm doing myofascial or whatever we'll be discussing, because a lot of the issues that they will have will be nutrition related. So getting away from specific foods, or introducing new foods, introducing lifestyles that would be more conducive to better health. So it's all kind of incorporated into it. Sometimes we were talking about GERD, so the gastroesophageal reflux. So lots of times that's combinations of food. It's not just eating at night, but it's the way the body digests the food. The body wants to digest protein first. So let's say you're going to have a sandwich and you find that you have a lot of GERD after you have the sandwich. Well, the body likes to digest that protein first, so it'll digest your meat, but then your bread will stay there and it will ferment. a little bit longer, and then you'll get that acid reflux later on. So just sometimes separating things into mono meals, having your protein first, and then maybe 30 minutes later having your carbs, and just separating your meals like that is an easy change without any medication, but just a simple change. So sometimes it's, simple things like that will be discussed, and patients will have questions on that, but it's they go home, they try it, and that was interesting. It's knowledge. It's learning about certain ways to help yourself in a holistic fashion. And that's, again, with digestion. So it's all part of the process. Yeah.
Right. And so people come to you, maybe they've had some type of surgery or something medically done, but does that mean that holistic means cannot help it, or it can?
Okay, that's a good question. So it depends. If they're coming to me for nutrition and they are undergoing cancer treatment, for example, if they're undergoing chemotherapy or radiation, then nutritionally I'm not going to be helpful in that way, because organic food is full of bacteria, and so they're already on a medication that will be counterintuitive to taking any type of organic food at that point. But if you're talking surgically, maybe someone has a knee surgery, knee replacement, something like that. I'm more than happy to see them. I'm more than happy to see them because we can work on scar tissue. Scar tissue, as it forms, it's just a trauma. So the scar tissue will build up, and sometimes that can cause another restriction as well for mobility. So we can just soften that scar tissue, get it nice and viscous again, so you have that freedom of motion. So multiple different ways of working with people after surgery. And like I said, it's, every case is individual. So, it's always welcomed.
I love what you have here on your page. It says, tension is who you think you should be. Relaxation is who you are. And it's a Chinese proverb. And
Yes.
Could you please explain it? Because I like the way it feels when I'm reading it, but I'm not exactly sure what is meant here. Tell us.
Well, I took it personally as expectations. We have these expectations of who we're supposed to be. But when you're relaxed, you find out who you really are. And it's much more of a calming, inviting environment. And tension is go, be the best, be the highest, not always. Maybe you're the best when you're calm. Maybe you're the best when you're actually not out there fighting and climbing every mountain. Maybe you get a better view from halfway up the mountain, and that's okay. It's a little bit more relaxed. It's a little bit more acceptable view.
Yes, I like that, truly. And it's also, so it's a state of mind too. So that's what I love about the holistic modalities of healing, is that they incorporate your thinking, your inner voice, your inner guidance. And it just feels more natural to me. So much is caused by stress. They say that so much is caused by stress, just like so many maladies, that end up coming out and playing out in things like cancer, diabetes. I've learned also from other programs that I've done that inflammation is a procuring cause. Would you say that the work that you do can help with inflammation?
Well, the body work that I do certainly helps with inflammation. Yeah, because that will, just moving that circulatory system, like I said earlier, the lymphatic system, but nutrition helps a lot with inflammation, eating the right foods. But when you were talking earlier about your mind, I deal with psychoneuroimmunology, which is working with the mind to heal the body. And there's no degree for that. I've studied it intensely and also found out that I'm a perpetual student, and I can't have a degree in that because there is no degree out there. But that is kind of, in the best case scenario, to explain it, it's if someone says, "Oh, I'm always sick. I'm always sick," and then the body's like, "Oh, you're always sick. I'll help you with that."
Right.
So the body will listen to the words that are coming out of your mouth. So if you say, "Oh, I just can't get up on time," well, your body will make sure you don't.
Yes.
So it's that reinforcing.
That's right.
That thought. So if you say, "I am healthy," and you know what, you're going to be healthy. Well, we all have a terminal disease. It's called death. All of us have that, and none of us are guaranteed. I mean, it's like death and taxes, right? So we all are guaranteed that. But you tell yourself you're going to be healthy, and you tell yourself you're going to be fine. And, looking at the glass half full rather than half empty helps you to move on to that
That's
next
right.
step. Yeah.
Your body responds to your thoughts, your feelings, and your words. So again, Dr. Sloan Samulski, you can find her. Give us an easy way to find you. And then, also, we want to remind everybody that in addition to all these incredible healing modalities that Dr. Sloan practices, she's also a children's author of quite a few books.
Yes. See, there's the joy. So my joy is not just, working with people, but I just love writing. So I've been writing children's books for quite some time now. So I've got 5 out there. I'm launching my 6th in the 1st of October. And so I author under the name Dr. Sloan. So, children's books. Yep. So I have, do you want me to say the 5 I have?
Yeah, sure.
Sure. I have giraffe book, porcupine book, yak book. That's a series. Then I have Peter and the Peanut Butter Save. And my most recent one is Marvin Pelican. And they all have gentle Christian themes. And it's just wonderful books about love and friendship and joy.
That is absolutely beautiful. So again, if you would like to find her books, in addition to finding her, but the books go under Dr. Sloan, kind of like there's Dr. Seuss and then there's Dr. Sloan, Sloan. Okay. Wonderful. Wonderful. Thank you. It's such a joy to know you. I want everyone to have the opportunity to experience one of your sessions, because it was really, for me, it was life-changing. And I just love it when people can find alternatives to living their best life, to being healthier, happier, and feeling good. And Dr. Sloan Samulski, you've got that down in spades. Thank you so much for joining us today on The Way Home.
Well, Laura, you are a blessing. Thank you so much for sharing with all of us.
Thank you all for listening to The Way Home this week, and to my wonderful guests. And may you all have a wonderful week that is safe, that's happy, healthy, and full of lots of miracles as well. I'm Laura Smith. See you next time from The Way Home.
Podcasts by Federated Media.